Hi, I'm Jude Smith. I'm Head of Nursing for Leicester Partnership Trust Community Health Services. I want to introduce you to our video that we've made about our Intensive Community Support Service, or ICS for short. ICS was set up to help people leave hospital sooner and to prevent unnecessary admissions to hospital. It's a unique service in that it provides a level of care for people who would have traditionally had that in an acute setting or a community hospital setting. We're looking to expand our community health services. We're looking for nurses, we're looking for allied healthcare professionals to come and join our teams. We can offer career development, excitement and innovative ways of working. If I've not convinced you, please watch the video and hear our staff and our patients talk about what ICS means to them. Thank you.
Well, basically, we try to get the patients out of the hospital, providing that they don't have any overnight needs. We can see whether we can get them out home with nurse and therapy assessments to see what we can safely keep them at home instead of keep bouncing backwards and forwards into hospital.
ICS is a multidisciplinary team. We have advanced nurse practitioners alongside GPs that give the medical coverage. We have occupational therapists and physiotherapists that help out, along with nurses and healthcare assistants. There's a whole load of us. It's a variety of job roles. We all get together and we all create the holistic plan for that patient.
We can deal from patients that require personal care, help getting washed and dressed in the morning. They might need assistance with medication. They might need dressings, or basic dressings, catheter care, any sort of nursing medical care. They might need monitoring observations-wise.
They seem to know it inside out, what to do with a, what's it called? Catheter. And they know exactly what to do.
Encouraging people to get back to being independent with their personal activities of daily living, but also their domestic activities of daily living and the sorts of things they do outside of that, so they can get back to doing the things they enjoy. So we our therapists, we've got occupational therapists and physiotherapists, and our technical instructors cover both occupational therapy and physiotherapy. So we'll go in and encourage people to get themselves washed and dressed in the morning, to walk through from one room to the other to practice their transfers and to progress their mobility, potentially from being hoisted back to being able to walk around the house unaided.
I really enjoy it actually, and I think it is a very good service. I'm not saying it just because I work here, but I do think it's a very good service. It is preventing people going into hospitals. We are giving them the same care in their homes. I feel as though they recover quickly in some cases, depending, on their illness, because they feel safer at home, more confident at home, and the families are around them all the while. And I really enjoy doing it, and we do give a very good service. I also feel, because we're all connected with the physios, the occupational health, and we've got good communication with GPs, they can get everything, all in their home.
I think in the most part, people want to be at home.
Yeah, they do.
In their own surroundings, where they can do what they want when they want, rather than having to conform to the hospital.
Yeah,
regime.
and also it's a good sort of gradual sort of going back into their own sort of environment. Because often when you've sort of been in hospital for a period of time, you come home, it can be a bit of a shock. Quite difficult to manage.
Yeah.
Whereas at least they know that initially they'll have some support, and that will sort of gradually sort of decrease as their needs sort of decrease. But at least it gives them that little period of adjustment. So that's quite useful.
And often there's other issues at home as well. There may be somebody that they were caring for who's had to go elsewhere while they've been in hospital. So it's about, you know, them coming back together in the home environment as well.
Yeah, it's looking after the whole family as well as that patient. You know, so it's making sure that everybody's safe, careful. And when you've been in hospital for a long time, it's your confidence. So once the team go in, the confidence, you can see the patients coming back and having the confidence built back into them being more independent then. You know, so yeah, it's good.
It's better if they're treated at home. I mean, I think I'm doing well. A physiotherapist came and put me through a pace this afternoon, and she says, "You're doing brilliantly, Anne." I said, "It's only because I feel comfortable that I'm doing it. If I'm in the hospital, it's like regimentation. You don't want it. You've been sick and you want to get better. As soon as I got home, I felt great."
From a nursing perspective, we're privileged to look after a patient within their own environment, because it obviously takes a lot to start letting strangers into your own property and into your own home and seeing what you've got or what you haven't got. We build up quite strong relationships with our patients within that environment, and over time they improve a lot quicker, get back to normal and carry on with their everyday lives.
They like working in people's
Yeah.
own homes. That's
Yes,
always quite
they do.
nice to sort
Yeah.
of, you know, because you do see your patient much more as a whole person in their own environment, in their own home. It's totally different to how they are in a hospital and stuff like that. And I think they like to see them sort of getting better and getting more able to do things.
And everybody's an individual in their own home, so you're very much led by what the patient wants to happen and where they want to be in the end. So you're sort of guided by what their goals are as to what happens when you visit.
But it really was good. And as for the ladies, I can't say nothing but brilliant. That's what they are. And I've got every faith in human nature after that.
You just don't know what you're going into, do you, really? Because I mean, it could just be, don't know, maybe just a wound care or for the package of care. But actually, when you've gone into the house, the nurses have actually found it. Actually, they've come out. Maybe they've done safe and well, but actually, there's a lot of issues going on in that house that wasn't highlighted before. So they've actually got to think on their feet. They've actually got to be communicating with the different the MPs, the GPs, the hospitals where they came from, because I mean they can come home without any authorisations, which is a bit of a challenge when you've got a list of other patients you've got to see, where you think maybe it'd be a half an hour visit. Well, actually you can be in there up to 80 to 90 minutes, even longer sometimes. So the challenges, I think, is a positive challenges, because you've actually got to, you're sitting there and you're getting the care that actually is needed for that, you know, catered for that patient.
And you have to think outside the box.
Yes, you do.
Yeah.
You know, it's not like you're on a ward where you've got, you know, lovely wide corridors you can walk down with your frame. You're in, you know, little houses with lots of furniture that people, you know, they're their personal belongings, and so you have to work around things and you have to, you know, problem solve and come up with that, you know, situations and methods of actually solving the problem and helping that person then.
Absolutely.
There is a lot of travelling involved, we totally appreciate that, but if you're just thinking about it, come out, give it a try, you'll be surprised at how much you're going to really enjoy it.
I think it's brilliant.
Yeah, it is good, it is good. I think, yeah.
We've had quite a lot of patients come through, working together with a therapist as well. It gives you a little bit more understanding as what the therapists actually do, you know, for the patients in their own home.
I think patients are often surprised at
Yes.
what is there. A lot of people, and relatives and families, they're often surprised at how much is available for people in the community. There does seem to be a general, you know, sort of not a lack of knowledge about it. You know, people are, you know, I think that they're often surprised that we work as late as we do, or that we can get equipment quite quickly and that sort of thing. So,
And they'll often say, didn't even know you existed.
Yeah.
And they'll say, well, you don't until you need the service. You often don't know what's out there, do you?
no.
And it saves the patient going back into hospital,
Yeah.
and that's the main thing.
Or gets them out early.
And gets them,
Yeah.
gets them out
Yeah.
either way.
Yeah, they like that, don't they?
Yeah.
They really are brilliant. They make me feel good. It restored my faith in people. I'm not joking on that. They're really good.
Oh, I usually get really good feedback from them. They're grateful, they think that we're very caring, which we are. And no, they're generally very grateful actually that they are getting that service.
The fact that we can go out, keep a patient at home and not make them go into hospital, because many patients don't like that. So if we can keep patients at home, give them the treatment, they're happier, they tend to respond better to treatment, and as a result we get the rewarding part and we get to see a happy patient. It provides a lot of opportunities for us to try new things, new equipment, new developments, and it's just a really rewarding job.
Yeah, to a patient, relax, let them do their job, they know it exactly. They'll do everything they want to do, that you should do, but don't interfere. Just sit back and let them do it, and they'll do it perfectly. They're a brilliant team, and I mean that.
I'm actually very proud of it. I know I'm just a healthcare assistant, but I'm actually very proud of the service. If I'd got my family that needed it, I would like them to have this service.
I love the job that I'm doing now. I find that the ICS side of things, because you don't know what you're getting on a daily basis, it keeps your skills and your knowledge more updated, and you're able to work on your own, use your own judgments with the backup of the multidisciplinary team if you need them.
It's a good service, and anyone that was coming to work here would absolutely love it. And for the patients, obviously, they know that they can contact a number and someone will be with them that day to help them and aid them, which I think is absolutely wicked.
I think that's my message to anybody who's been ill. Sit back and let them do what they know what they're doing. Because they're brilliant, they really are. I can't emphasise that too much. I think they're a wonderful crowd.